During a press conference on Friday, top government officials first briefed journalists on the progress the country has been making in its fight against the pandemic, 6.5 months after it was first detected in the country. During the second half of August and towards the end of September, there were significant changes in the COVID-19 infection figures we issue every evening, which is an indication that people have put in a lot of effort when it comes to the implementation of preventive measures. As you know, the latest figures from the last few days are very encouraging compared to August, but the fight continues. Strategies to treat and fight the spread of the virus include treatment at home for some of those that contract it, depending on their symptoms and other factors, with 1,000 treated in this way and 600 having fully recovered. Officials are also pleased that people have been implementing the preventive measures rather well. Be it in the wearing of masks or the numbers of vehicles driving around during the curfew, social distancing, people being home when they are supposed to be, bars that operate illegally. When you look at all those things, those that break the measures in place have reduced by between 20 and 30% when you compare this week to the previous one, around that range. Despite the progress, there are still some challenges. Some restaurants have been transformed into bars, with customers drinking all day with plates of food on their tables to make it look like they are having regular meals. People who do such things should know that they are breaking the measures in place. Then there are waiters who give customers alcohol in thermos flasks and cups meant for tea. We are uncovering such tactics and they are not allowed. We want to emphasize that people should respect the measures in place as a way of fighting the pandemic, and no one should be forced to do so, supervised and punished. Rwanda's economy has suffered because of COVID-19, with the country's GDP falling by as much as 12% for 3 months straight, April, May and June. Efforts are therefore underway to revive it.
Efforts
have continued, even though land borders remain closed, but the airport was opened in August, so we are working to ensure that goods are imported without hindrance, and at the EAC level, a system has been introduced so that harmonization is implemented in the transportation sector, with drivers entering our region are tested for COVID-19.
Then there is the matter of the vaccine. The vaccine will begin reaching us between mid-January and March. That is the period to wait for. We believe we may get it around then. But there is also the question of how we are to prepare for it, how to train our workers, how it will be stored in freezers, and how it is to get to health centers around the country and at other facilities. These are things we must consider because this is not the first new vaccine we will be getting as part of our immunization program. Since the first COVID-19 case was detected on Rwandan soil in mid-March, it has so far killed 29 people and infected thousands more, with more than 1,600 cases still active and more than 3,000 recoveries.